Eamon Ryan.
I did ask Taoiseach yesterday so a couple of questions, didn't get an answer. The first one was, in this two-phase approach, did you not realise in February 2017, when there was then 950 million for the hospital and 100 million for technology and 100 million for equipment, or IT, and 100 million equipment, anyone I talked to with an expertise in the area said alarm bells should have been ringing. It shouldn't have been waiting until August 2018 to realise you had a problem. That's when the problem became clear. Why is it that that didn't become aware at that time, that that was a fatal mistake in your two-phase process? It was clear just a figure off the air, 100 million for IT, 100 million for technology. Why didn't the process stop then and start getting it right?
So I appreciate the Deputy doesn't want me to repeat previous answers, but obviously I've already outlined the rationale behind why the two-phase project was decided, so I won't put that on the record of the House again. It's April 2017 when the government signed off on the figure of €983 million. I think the Deputy makes a fair point in relation to what happened with the elasticity in relation to Phase B. How could the government of the day have been informed with significant expert advice that the expectation was that when further detailed work was done on Phase B, the price range would be 983 million. That's something as a government that we're extremely disappointed in. It's something that I've already flagged as a cause of great concern, not just to me but to taxpayers, and it's something that I need PwC to get to the bottom of. Of course, there were advantages, obviously, with proceeding with Phase A. There were also, in terms of getting it done at 2016 prices, and indeed bringing it in on budget as well. But I don't dispute the fact that the Deputy outlines, I think, what is righteous disappointment on behalf of taxpayers, that there was such a big disparity between what we expected Phase B to come in at and what it did come in at.
Is it true that I'm not certain on this, I'm asking to be informed, that the professional service companies, the likes of the architects and others, were on a fixed percentage contract, and therefore when the cost ballooned, their percentage went up as well? And if so, what might that have cost?
That information, Deputy Ryan. I will ask the National Pediatric Hospital Development Board to provide it to me, as I'm sure the Taoiseach probably has since you raised it yesterday, and I'll come back to you directly.
Lastly, if I can, to the Minister for Public Expenditure. I was thinking in my own head, is there any hospital we've built like this in the past? And I thought, well, Tallaght. Tallaght was completed in opened in 98, I think. 560 beds, 12 theatres. It's not that different. 140 million, I think, was the cost. Tullamore might have been similar, but Tallaght I'd be familiar with. Where in the institutional memory of the Department of Public Expenditure and Reform? I read there was a Deloitte report on because they were worried their capital overruns of 2.5 million in Tallaght, and there was uproar, and Deloitte were asked to look into it. Where was the institutional expertise and memory in the Department of Public Expenditure and Reform that didn't just go back to 98 and look at what do we do in Tallaght, and why would we not repeat the same, or how come that expertise in the department seems to have disappeared?
But these are completely different projects. The hospital in Tallaght, some of the other hospital projects that have been mentioned here this evening, are completely different in complexity, they're completely different in scale, and they're also different in process to the National Children's Hospital, Deputy. They are completely different.
Minister, it's
like comparing experience that we have in building a road to experience that we have in building a metro. They might be in the same policy area, but they're very, very different projects in scale. In relation to the institutional learning of my own department, again, the institutional learning that exists in my department and in the Minister for Health's department has been successful in delivering many other very, very important projects that I've already touched on today, and we are acknowledging very clearly in relation to this project there are clear learnings for projects of this scale, all of which we acknowledged yesterday, and what we are going to do to address it.
So what I hear it's like cabling. The cabling for a children's operating theatre versus a general operating theatre, I refuse to accept that couldn't actually have been managed from previous experience. I don't believe that the big cost overruns are necessarily because of some high-tech medical difference between a children's hospital and a general hospital. I think you just got the process wrong.
And the Minister has a closing statement.
In terms of the number of theatres, the amount of technology, and the role of the scale and the nature of the project, they are fundamentally different. Thank you. Ceann Comhairle, and I want to acknowledge all the questions and points that have been put here this evening. As I and the Government have acknowledged over the last number of days, we have made progress in how we can deliver very, very important capital projects well. We have made progress in Ireland 2040. We can see both within the Department of Health and across other government departments examples of how projects are delivered well and how they can deliver benefits to communities and to citizens. If we look at where we are across 2019, in healthcare alone, we're going to see very important developments delivered in Cork University Hospital. We'll see very important projects delivered in Letterkenny. We'll see improved services in Kerry. We'll see improved services being delivered in Portlaoise. These are capital projects that communities and the country wants, that the government is delivering. In relation to accountability, we've seen Minister Harris, we've seen myself answer the questions that different deputies have put to us. We've participated in committees in relation to us, and both of our government departments have made available all the information that we have on the matter and are subject to the full rigours of accountability here in this House. We're also going to see, when we launched Ireland 2040, we saw deputy after deputy deny that these projects were ever going to happen in Ireland 2040. We're now seeing deputies here today saying that the projects are going to happen, but they're wondering if they're going to be delayed. This is the government that has significantly increased our investment in public capital for this year. It's over €7 billion for this year. We are planning to find ways to increase it further. We have acknowledged what could have been done differently on this project, the learnings that we already have, and how we will learn from projects of this scale in the future. We have acknowledged how taxpayers and citizens feel about this project and the concern that families and children have who will depend on the delivery of this project in the future. That, Ceann Comhairle, is why we published yesterday what we will do differently for projects of this scale in the future, how we can change our processes, and the further work that will happen to ensure that government departments and agencies are equipped to deliver projects of this scale. But in acknowledging that, Ceann Comhairle, I will continue to make the point that whether it be in transport, whether it be projects like the N4, the RD bypass, the Ballyverney to Macroom project, transport projects that deputies in this House want, whether it be the additional 6,500 homes that are being delivered in Ireland 2040, whether it be projects that are underway in the Department of Education, new schools that are being built, schools that are being restored and repaired. They are examples of capital projects that are happening, that are being well delivered by the state, that are being looked for by communities. What the Minister for Health and I have acknowledged is that in relation to this project, there are clearly key areas in which we will learn from in the future. This project is one that will matter for children, it will be one that will matter for health in the future, and we have acknowledged again and again now what needs to be done differently for projects like this and the learnings that we already have in relation to it. We'll progress with both priorities, Ceann Comhairle, looking to deliver projects that the country needs and looking to ensure that a project like this National Children's Hospital, that it is delivered, and when we move on to other big projects of this scale, that the learnings we have, that I and the government are acutely aware of, that they are learnt and they make a difference to other projects like this in the future. Thank you.